Imagine this. A man stood up to give a speech, then realizes that his trouser has a pool of blood behind him. What do you think it is? Hello, this is Cynthia Kapesa, a clinician more than a decade now. So today we are going to talk about hemorrhoids. It is something that is very common, but very few people tend to understand what it is and how it comes about. So what are hemorrhoids? Hemorrhoids, also known as piles, are commonly associated with conditions that increase pressure in the venous system around the rectum. For example, straining during bowel movements. Especially for those who suffer constipation, you are increasing the pressure down there. The strain causes the veins around the lower rectum and anal region to become swollen and enlarged. Other causes include age, that is the age between 45 to 65 years, but can also occur on any age or at any age. Sitting for long periods. For us who sit for so many hours attending to patients, for those who are sitting in offices, those in the corporate world, they suffer such. Chronic diarrhea or even constipation can cause this. Obesity, when you're very big, your BMI is up there, you will suffer hemorrhoids. Pregnancy can also, at times, not everyone suffers, but pregnancy can be a reason as to why some women suffer from hemorrhoids. Anal intercourse, low fiber diet. Those who hate vegetables, kindly start eating them today. Weightlifting. So what are the major types of hemorrhoids? We have the internal hemorrhoids and the external hemorrhoids. So the internal prolapse can be classified into 4 stages. Stage 1, which is asymptomatic, you don't feel anything. Stage 2, prolapse during bowel motion but spontaneously reduces itself. When you're going to ease yourself during the long call, it comes out but reduces back itself. Stage 3 is when prolapse is manually reduced. You go ease yourself after a long call, but you have to push it back with your fingers, and is often accompanied by pruritus and soilage. You'll feel some itchiness and that place will be wet. It will have some mucus consistency, kind of. Stage 4, prolapse that can't be reduced and is accompanied by local inflammatory changes. This is whereby you can't reduce it with your fingers and it is inflamed, meaning there's a lot of pain. So under external hemorrhoids, they occur as lumps outside the anal region. Blood can thrombose and clot, which also causes pain. So how is the diagnosis of hemorrhoids done? 1, there'll be a general examination done on you on the abdominal region, and then we also examine the perineal area and rectal areas. A digital rectal exam can be done with your consent using gloved and lubricated fingers, whereby they're inserted to feel the masses, assess the tenderness and fluctuance. So treatment. How are hemorrhoids treated? We have the non-pharmacological way, whereby you tend to change your lifestyle and eat a high fiber diet. You can do warm water sitz baths. Warm saline water, you sit for some 20 to 30 minutes. Drink plenty of fluids. Rehydrate always. Avoid long periods of sitting. Have breaks in between your sitting positions at work. What are the pharmacologic ways of treating? We have hydrocortisone containing preparations like suppositories, creams, and ointments that can be applied down there. We have NSAIDs for pain relief. Those are the painkillers. Laxatives to soften stool, especially if the client reports of constipation. So those people who are suffering constipation, there are laxatives that you can be given to loosen your stool and prevent hemorrhoids. There's a surgical intervention whereby a rubber band ligation is put around that prolapsed hemorrhoid and at the base of the hemorrhoid, cutting off its blood supply. It tends to cut off blood supply, hence it will just fall off. Another way is surgical, where you go into theater and it's surgically removed. We also have sclerotherapy and laser therapy, or laser therapy in those advanced facilities. So what are the complications? When you lose a lot of blood spontaneously, you might end up with anemia, which is the common cause. Blood clots in external hemorrhoids, they cause a lot of pain. You will predispose yourself to infection because that place is inflamed and open. And then you also might end up with skin tags. Now let us note this. We only refer when we notice that maybe there's rectal prolapse. So this person will need a major surgical intervention, or we notice that it's colon cancer or suspect it, we will be forced to refer this patient to a referral facility, or in cases of fistula where there's a big tear, you will be referred for proper management. So I hope you've learned something today.